this article, we discussed that with the loss of visual cues and support systems, current COVID-19 policies such as universal masking, social distancing, and unaccompanied patients in often noisy healthcare environments may unmask significant hearing loss related issues that previously had been diminished or ignored. This can be detrimental to effective communication, patient safety, and quality healthcare. I'm Richard Tenholden, Assistant Professor in the Department of Ophthalmology at Mayo Clinic, Florida.
Hello, I'm Dave Fabry, Audiologist and Chief Innovation Officer at Starkey Hearing Technologies.
We're the authors of a manuscript entitled Impact of Hearing Loss and Universal Face Masking in the COVID-19 Era, published online ahead of print in the October 2020 issue of Mayo Clinic Proceedings.
While epidemiologically appropriate during the current COVID-19 pandemic, social distancing and universal face masking policies are having a profound and negative impact on individuals with hearing loss. That's really the key takeaway of our paper. Social distancing from the typical 3-foot distance to a 6-foot difference has a dramatic impact on the intensity of speech and can reduce it by up to 6 decibels. Nearly half the volume is cut by social distancing. And then when you add in on top of that, the inability to lip read and use visual cues with face masking, plus the attenuation of important energy. Most face masks, although all masks are not created the same, will reduce the critical high-frequency information so essential to speech understanding. What I mean by that is consonant information, such as S, FS, TH, are high frequency, and those are the regions of speech that are reduced the most by any mask. This combination of increased social distancing, the attenuation of important speech cues, and the loss of lip reading capability render speech almost unintelligible by individuals with hearing loss. And when you add in background noise on top of that, it creates a really difficult and challenging listening environment.
Being unable to see facial expressions and visual cues, verbal cues, impedes the patient's ability to understand the healthcare provider and perceive empathy. It also impedes the healthcare provider's ability to monitor the patient's facial expression and nonverbal cues of potential misunderstanding during the encounter.
Imagine, not only does masking contribute to a communication breakdown, it also conceals the fact that a communication breakdown occurred. This is astonishing given that prevalence for hearing loss affecting speech intelligibility for the 60 to 69-year-old age category is nearly 40%. So if the patient, healthcare worker, or both have hearing issues, a communication breakdown is quite likely.
In the healthcare setting, the over-reliance upon oral communication as the sole or primary method of communication can be ineffective and inappropriately dangerous. When provided, medical information must be complete, accurate, timely, unambiguous, understood by the patient, and understood by the healthcare providers as well. In addition to bringing this issue to your attention, we also offer the following suggestions and strategies to ensure clear, empathetic communication is maintained.
Providers may wish to utilize any of the following mechanisms or communication strategies to ensure effective, empathetic communication in these situations. For example, reduce background noise whenever possible. Obtain the individual's attention. We're programmed to hear our name and break attention from whatever we're concentrating on when someone says our name. Ask how the individual prefers to communicate. Confirm hearing aid users are indeed using their devices. Speak slightly louder and with a minimally reduced rate, slightly slower rate than typical. rephrase rather than simply repeating the same words because of the issue that that important consonant information may confound their ability to understand. If you use slightly different words, it will help and assist in comprehension. Take turns when speaking so that you're not speaking over each other. And optimize positioning, that is, try to be face to face with the individual, not moving around or walking aside them if it's possible. Use low-tech methods such as pen and paper or clear partitions if you're looking at a face mask with a window to assist with those lip reading skills. Use high-tech methods such as Wi-Fi enabled tablets, video apps on smartphones, and use video conferencing platforms like this one for telemedicine, unmasked, without PPE, when there is a diminished risk of transfer of disease. As I already alluded, use clear or clear paneled masks to improve visibility of facial expressions and lip reading cues. Use personal sound amplification products if the individual isn't a hearing aid user, but if they're available for their use on a temporary basis. And to that end, use loaner hearing aids or frequency modulation FM systems along with a microphone lapel to improve communication when background noise is present. And finally, use scribes or professional support staff to assist healthcare professionals with hearing loss so that they're not missing any of that critical information necessary for communication.
So what is Mayo Clinic doing about this? Mayo Clinic has implemented many of the mechanisms and strategies that Dave has just mentioned. Using myself as an example of an individual with hearing loss in both the role of the occasional patient as well as a full-time active healthcare provider. I've employed video chat apps for person-to-person conversation, video conferencing for group meetings, asked for and received permission for clear math to improve visual cues and lip reading, asked for and received approval for a technician scribe to work with me in my exam room. I'm grateful for the support of my departmental and administrative leadership on this issue. We're doing all we can to ensure clear, effective communication during this pandemic. For both its workforce and its patients, Mayo Clinic's unwavering commitment to diversity, inclusion, and equity remains strong as it strives to be a welcoming and equitable healthcare organization in the COVID-19 era. We hope that this manuscript calls attention to this issue and provides other healthcare providers and organizations with strategies and resources to help address the communication challenges while providing compassionate care to individuals with hearing loss during the COVID-19 pandemic.
Thank you for joining us and for watching this video.
We hope that you find the Mayo Clinic Proceedings article helpful. If so, please share with your colleagues who may be interested by using the share link. Thanks for watching.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.